I'm a third-year chemistry major. Diabetes is the leading topic of this presentation. Diabetes is a major public health problem that is ranked as the seventh leading cause of death in the US. As many people are affected, it is equally important to learn more about it. So here we go. In the second slide, we're going to be addressing the public health problem and why it exists in society. But first, we must understand that there are two different forms of diabetes, which are type 1 and type 2. Many risk factors overlap, but their causes are very different. For type 1 diabetes, the person's immune system attacks and destroys the insulin producing cells on the pancreas. Therefore, there is a constant need for insulin. Type 2 is most commonly linked to family history. Lifestyle heavily influences the chances of getting type 2 diabetes, along with obesity and the lack of exercise. The lack of healthcare also dramatically affects the chances of preventing diabetes. Due to this, members of the low socioeconomic background are more prone to develop diabetes. Diabetes affects a great majority of the populace. The CDC predicts that these numbers will only continue to increase. In addition, they also state that more than 100 million people are living with diabetes and prediabetes. The International Diabetes Federation predicts that as soon as 2045, there are going to be 700 million people affected worldwide. If we refer back to the image on the second slide, we can see the numbers increase in North America and the Caribbean, which is predicted to increase by 33%. The CDC demonstrates the prevalence of diabetes by ethnicity on the third slide graph. Amongst that, we can see the African Americans, American Indian, and Hispanics. For this reason, they are more likely to develop type 2 diabetes, especially people who are over the age of 45, overweight, or fall within those ethnic minorities. For type 1 diabetes, it is most commonly affected for young adults and children. Research is being done on their gene mutations to try to find a reason why this happens. For this fourth slide, we're going to be addressing how to solve the public health problem. I researched a variety of different strategies, and I came upon education and the employee lifestyle change participation as the most important. For education, it is a form of primary intervention that is implemented to raise awareness. Advertisements suggest eating smaller portions of healthy foods, increasing the physical activity, losing weight, and visiting a doctor. All these changes decrease the risk of developing type 2 diabetes, and a doctor visit will allow people with prediabetes to reduce and prevent those chances of developing type 2 diabetes. As a secondary form of prevention, there is the employee lifestyle change participation. Many companies combat diabetes through the Employee Lifestyle Change Participation Program. In Maryland, the Department of Health and Mental Hygiene determined that obesity and diabetes are a priority and should be reduced. Through a program called Healthiest Maryland, it created a culture of wellness where they promoted the use of stairs, reducing weight, and diabetes management. In Australia, for instance, they tend to do things a little differently. In order to combat other public health problems, such as diabetes, they have a publicly funded universal health insurance known as Medicare. Through Medicare, the health agency monitors diabetes at the national level. On their website, the NDSS implemented a program known as the Diabetes in School, as seen on the image on the PowerPoint. This is a form of tertiary prevention as it helps parents to support their children. Another program that Australia has implemented are Life, Beat It, and My Health for Life. Life is a lifestyle modification program that helps reduce the risk of type 2 diabetes and cardiovascular disease. All of these programs are lifestyle modification programs that make a difference on the Australian populace. In Canada, they conduct a periodical survey every 2 years to determine who is affected by diabetes. The people of Canada also call upon their government to address the diabetes epidemic to spark a major change. Similarly to Australia, Canada has a universal healthcare to ensure that people can live a long, healthy lives. Canada has also implemented the Canadian Diabetes Prevention Program to investigate the efficacy of an intensive digital and telephonic lifestyle change program to help reduce the risk of developing diabetes. This program was inspired by the CDC and also makes a great change on the Canadian population. In order to In order to address the public health in the future, we can implement a variety of different things to prevent diabetes. In order to have a major change happen, heavy lifestyle changes need to be implemented. Education is also very important because if more people are aware of the risk and their chances of developing it, it will prompt a change among them. Raising awareness also is very important because then it can prompt the government to take action and even raise more money to go into research to determine the cause and to how to prevent diabetes. Not just type 1, but also type 2. In my opinion, the US should implement a universal healthcare so that it is readily available to the public, and genome mapping should be used to determine more details into who is susceptible to preventing the disease. That is all. Thank you so much for listening and hope you learned something about diabetes.